Speaker, the COVID-19 pandemic has exacerbated the mental health crisis among American students, educators, and families. In 2021, 44% of students experienced persistent feelings of hopelessness. Almost 20% seriously considered suicide, and 9% of American kids attempted suicide. Regrettably, 80% of youth in need of mental health do not have the services that they need in their communities to heal. As a result, educators have been forced to play an outsized role in supporting and responding to students' mental health needs, leading to increased depression and trauma among educators, their students, and the families in the community. However, our schools do not have the specialized staff necessary to respond to the increased prevalence and complexity of students' mental health needs. According to a 2019 study, no state met the student to social worker ratio of 1 social worker for every 250 students, as recommended by the National Association of Social Workers. Not one state. On top of that, the national ratio of school psychologists per students during the 2020 to 2022 school years was 1 psychologist per every 1,162 students, more than double the ratio recommended by the National Association of School Psychologists. Clearly, this isn't acceptable. The rise in mental health challenges is not isolated in students and educators. Nearly half of the United States' workforce now suffers from mental health issues since COVID-19 and the pandemic started. Yet many workers are denied the mental health and substance use disorder benefits they are legally entitled to receive under their employer-sponsored health plan. In a recent report to Congress, the Department of Labor, Health, and Human Services and the Treasury found widespread violations of the Mental Health Parity and Addiction Equity Act by group health plans. These plans, unfortunately, some of them, are failing to maintain parity between behavioral health benefits and physical health benefits as required by statute. The report recommended that Congress enhance the Secretary of Labor's capacity to enforce the parity law, including providing authority to impose civil monetary penalties for violations. Notably, the same recommendations were made by former President Trump's Commission on Combating the Opioid Crisis, which was led by then New Jersey Governor Chris Christie. In response to these violations and the national mental health crisis, I introduced the Mental Health Matters Act, which includes proposals championed by several committee members. This legislation helps Head Start agencies implement evidence-based interventions to improve the behavioral health of children and staff in Head Start programs. It improves trauma-informed services in schools by developing innovative initiatives to link schools and local educational agencies with local trauma-informed support and mental health systems. It requires colleges and universities to accept existing documentation of disability and provide reasonable accommodations so disabled students can achieve success in higher education. Also provides the Department of Labor with enhanced authority to ensure that private employer-sponsored group health plans and insurers comply with the mental health parity and related laws. The bill ensures workers who are wrongfully denied health or retirement benefits under their job-based plans have meaningful access to the courts. And finally, this legislation directs the Department of Education to award grants to build a pipeline of school-based mental health service providers and increase the number of mental health professionals serving in elementary and secondary schools in high-need areas. Mr. Speaker, simply put, the Mental Health Matters Act delivers the resources students, educators, and families need to improve their well-being. I urge my colleagues to support this legislation, and I reserve the balance of my time.